Good afternoon. I'm Amy Smaller, Senior Director of Healthcare Education and Professional Development at the Massachusetts Health and Hospital Association, and I'd like to welcome you to today's webinar, Navigating Leave of Absence Challenges. A few logistics before we start. We are in listen-only mode today, so if you have any questions, please enter them into the chat feature, and we will do our best to get them during our time together today. I'd also like to take a moment to thank MHA's 2026 annual sponsors, as well as our strategic partners, for underwriting today's webinar, as well as many other events that we offer throughout the year around timely issues and bring experts like those we have with us today. I'd like to welcome our speakers and panelists for today. We have Whitney Day from the Spring Consulting Group, Grace Giannatasio, who's also from Spring Consulting Group, Laura McCormick, who's Director of Employee Health and Leave Program at Bay State Health, and Shep Spaniak, who's also a Senior Partner from Malaria Group. And also giving a short welcome is Chris from Malaria Group. And Chris, I'll hand it over to you to get us started.
Terrific. Thank you, Amy. Hello, everyone. My name is Chris DeLuria. I'm a Senior Vice President here at Malaria Group, and this is our first presentation to the membership as the new MHA Solutions. And we are thrilled to be here and hope you walk away with at least one idea that you find useful in your day-to-day work. You may have seen an announcement earlier this year, but MHA Solutions, which has been around for over 30 years, is now part of Malaria Group. We are a regional and national broker consultant and have partnered with MHA to develop risk management and benefit solutions for the members. We are inspired and motivated by the unique partnership and revenue sharing agreement we have with the MHA that will provide well-needed funds for future investment in the membership from the programs we develop together. Thank you again for having us. We're thrilled to be here, and I'd love to turn it over to Whitney and the team now. Whitney?
Thanks, Chris. We're going to start today with a couple quick questions for the group. We're curious how many of you have employees outside of the state of Massachusetts, and you can put your answers within the chat. If you want to either raise a hand or put in yes, that would be fantastic. We'll give it just a quick second. Seeing some yeses, seeing some nos, 5 or 6 remote. Okay. So just a few that have some outside Massachusetts employees. Okay. The next question that we're curious on is what return to work strategies have been most successful for your system? We've got a couple options here that we've found within the market. So assistive equipment or ergonomic adjustments, potentially a centralized return to work or coordination team, job reassignment within or an ADA accommodation, light duty within their own role, a modified duty, so something along the lines of a reassignment for a temporary period of time, transitional return to work or gradual return to work, or only allowing people to come back at a full duty capacity. If these are any of the strategies that you have implemented, please feel free to put them within the chat.
Thank you, Whitney. I could add a few things here too. In light of the expanded Mass PFML, we're all very familiar with and experience every day, the focus on safely returning employees back to work sooner is now more critical than ever. We've got longer durations of claims, employees are out of work longer, and that does put a pinch in our staffing levels. So when we take a look at our return to work strategies, it is a sometimes challenging balance between ADA accommodation requirements, staffing challenges that are needed, and employee safety, bringing them back to work. But what is unique about our healthcare environment is that we must also consider patient safety. So that's an added layer that a lot of the other industries don't necessarily need to consider. So it looks like a lot of your responses here are very common. Ergonomics, yep, great stuff there. Thank you. Absolutely. Something to consider in our industries with our staffing challenges is the common question that comes up from our leaders. Can we afford to have our employees home while recovering, or do we engage them with some productivity through a temporary project work? So a work hardening program. And of course, if it is workers' comp, there's some, laws around that, but also an impact on their claim. But non-occupational, sometimes that is a negotiation with the employee. So, for example, we do get this a little bit. An employee is, let's say, an OR nurse. She's returning from a total knee replacement. Her restrictions coming back may indicate that she's unable to stand for her full 12-hour shift. So perhaps considering that work hardening opportunity by offering a temporary assignment to another department, perhaps doing triage, chart audits, or even joint commission prep. So we do recommend that you work closely with your employee health or occupational health clinic to engage in that interactive process with the employee and the manager on finding the right way to bring that employee back to work to allow some level of productivity. Thank you.
Thanks for that insight, Laura. That's very helpful. Next, we're going to have Grace walk us through some of our information on the paid family medical leave and paid sick leave landscape.
Thanks, Whitney. So really, I'll go through it really quick, but the landscape is constantly changing when we're talking about paid family and medical leave and other laws. But if we're focusing on this for today, looking at the list on the left, everything in the dark teal and above are really programs that are currently in place today or that are almost in place, and we're working through that implementation phase. And when we're talking about these laws, they really apply based on an employee's actual physical work location. So I know most people said that they had employees only in Massachusetts, but if you do have employees who may be working remotely or in neighboring states, there could be some overlap. And you could have employees, working in Rhode Island or New Hampshire or Maine, Connecticut, that you want to make sure that you're providing those appropriate benefits and administering those programs correctly. So I just really want to emphasize the fact that the employee's work location is where these laws apply. So you really want to make sure that you know where your employees are, you're tracking them as they're moving, and that you have a practice of keeping up to date with these. So we do update this map on a monthly basis or quarterly basis right now. We always have it available to share. It's also available on our website if you're ever looking for more information about what these programs look like. And then the next slide, we have a similar look, but on paid sick leave and mandated PTO. This is a little bit more colorful because there's also a lot more local paid sick leave laws. So a lot of towns, cities, ordinances have additional programs in place that employers have to comply with. Most often, employers are handling this through their own PTO or paid sick leave program with additional addendums or exceptions for certain state requirements, but I also want to underline that some of these laws have certain components to them that are a little bit more complicated. So a lot of employers tend to have, a paid sick leave policy that might be very generous, might have, 120 hours for employees and then 40-hour carryover. Other certain states or laws might require that all accrued time carry over. So there's just certain little nits and gnats that need to be, paid attention to and reviewed on an annual basis at least, to make sure that the programs that you have in place are compliant.
The next slide is going to walk us through information on the Massachusetts PFML law. As you know, this went into effect in January of 2021. And it is applicable to all private employers with at least one Massachusetts employee.
And then when we get into, beyond which employers are covered, it really goes down to the employees. So this localization, like I just mentioned on the map slide, an employee's work has to be localized in the state. In most locations, that means that the employee spends the majority of their time physically working there. So if they work from home, that means they're physically working from home the majority of the time. Certain states have different requirements, but Massachusetts, that's what it is. It also requires that employees have earned at least $6,300 in the last 4 completed calendar quarters and at least 30 times the employee's weekly benefit amount. I do want to emphasize that. And it's important that if you're with the state or if you're with a private plan, that both of those clauses are being qualified in order to ensure that employees' eligibility. Oftentimes, we found that employers who have a private plan, sometimes the carrier or administrator who's managing it on their behalf is only handling one of those clauses. And a lot of the times that's because of what's being passed on the file feed. So it all kind of has to be traced back to make sure that it's all being administered appropriately. And you're not necessarily being overly generous or more discriminatory than what you're supposed to be doing. Massachusetts PFML is also available to employees that are either actively employed or that have terminated their employment within the last 26 weeks who are not with the new employer. So if they're still within that period and you have a private plan, you're still responsible for administering that. And I know I keep mentioning the private plan, so I'll just talk about that for a second as well. Massachusetts, you do have the option of going with the state, so you can just send all of your employees to the state to get their leaves paid out. You could also establish a private plan that I know Laura can talk about a little bit later. And you could decide to do that either just for the medical leave, just for the family leave, or all encompassing for the whole program. For the leave entitlement, the full benefit is up to 26 weeks in a 52-week period. That is broken down by type of leave. So you can take up to 12 weeks for family leave. So to care for a family member, for bonding, or for a military exigency leave, and then up to 20 weeks for medical leave. So for your own medical condition, and then up to 26 weeks in total to care for a covered service member, which is what we see under FMLA.
And similar to FMLA, the qualifying reasons align with one serious health condition, care of a family member with a serious health condition, child bonding, again aligned with FMLA with the 12-month requirement, and then qualifying military exigency and care of a covered service member.
And then for the pay calculation, anyone who has tried to do this knows it can get a little bit complicated. So there's a two-tier calculation that has to go into effect. If you take the employee's wages, you'll take it, and any amount that is below 50% of the state average weekly wage, the employee will get 80% wage replacement on that portion. And then for any amount that's 50% or above, that'll be 50% wage replacement. And it's all capped at a maximum of $1,230 for this year. So some of these components can change, usually on an annual basis, which usually applies to the maximum. And then for any approved period of leave, that portion is job protected. So the employer has a requirement to return that employee to work once they're completed with their leave.
And your neighboring state, Rhode Island, is captured on the following slide. The Rhode Island Temporary Disability Insurance is one of the initial programs that went into place back in 1942. And the temporary caregiver insurance is still one of the earlier programs in 2014. And this does cover nearly all private employers, similar to Massachusetts, with one employee working in Rhode Island.
Yeah, and similar to Massachusetts, they all have similarities and differences, but there is also a localization requirement in Rhode Island, so the employee has some physical presence there. The employee also has to have paid at least $19,200 in the base period. So that's typically the previous completed 4 quarters in the past 5 quarters, or earned at least $3,200 in one base period quarter, and total base period taxable wages are at least 1.5 times the highest quarter earnings. And the base period taxable wages are at least $6,400. So it's really important to, again, pay attention to all of those clauses. And in Rhode Island, the employee has to be actively employed. So if they have terminated employment, then they're not eligible for PFML. And we keep saying PFML, TDI, TCI. They're kind of all different terms, but they all mean the same thing. The TDI portion is the disability portion. TCI is the family caregiver portion. And we all kind of refer to them as an all-encompassing PFML. And then for the amount of leave available in Rhode Island, for the TDI, which is, again, the disability portion, an employee can take up to 30 weeks for their own condition. And then TCI, they can take up to 8 weeks. They recently added a few different coverages here so that bone marrow donors can also access 1 week of this paid benefit, and organ donors can access 30 days.
And underneath the qualifying leave reasons, the disability is again only for your own serious illness, surgery, or injury. And under caregiver, it is for care of family member with a serious health condition, bonding, and as Grace mentioned, bone marrow organ donation.
And then the pay calculation here is a little bit more straightforward, but only a little bit, as it's based on quarterly wages. So the benefit will be 4.62% of their employees' wages paid in the highest quarter of earnings in the base period. And then they also provide, they're the only state to do this, they also provide a dependency allowance, which is the greater of $20 or 7% of the total benefit rate. And they'll provide that for up to 5 dependents. So the maximum benefit that someone can receive in a week is $1,103, or if they have that dependency allowance, it could be up to $1,489. And then Rhode Island also has a minimum benefit, which is $148. And then just in total, the benefits together cannot exceed 30 times the employee's weekly benefit rate in a benefit year. And that maximum really comes into play when you're talking about the duration. So it just can't be longer, so that the employee doesn't receive an additional benefit there. And then again, the employer is required to return an employee to work after a period of approved leave.
So we're going to move on to the decisions around PFML programs. And we're curious from the participants how you administer your PFML or state leave programs. If you can put into the chat whether you have a private plan insourced, a private plan outsourced, if you are state administered, or if that varies across your population. Seeing some state administered. Ooh, a lot of state administered. We've got a private plan outsourced. Okay. We've got a little bit of variety, but overall mostly state administered programs. For those of you in that bucket, have you considered moving to a private plan or changing your funding mechanism for your state PFML? So the responses here that we are curious on is if you are private and considering moving to a state, although I think most of you are within the state. So if you are a state and considering moving to a private, or if you're not considering any changes. Okay, we've got some not considering for the most part. Okay. Okay. A lot of people are very satisfied with the state administration. Good. Okay. So in the next section, one of the things that we do is support people as they make that, as they do make that decision, if you are under consideration for a change. As many are not, we'll touch on each of these categories at a higher level. So there's claims, cost, control, and compliance that are really the main factors when you are considering these plans and moving to a private plan. And Laura's made many decisions around their programs and is going to hop in here on a couple of topics. But under the claims considerations, we really want to be able to think about where you have your employees working and if the private plans are allowed, and if your disability program and FMLA program are already outsourced. If those are, then we want to start considering the employee experience and that claim experience. Within the next slide, we're going to talk a little bit about cost. So this is where we want to look at your overall budget as a program. And based off of how your claims are being processed or your overall cost of your program, you want to be looking at your risk tolerance. So consideration of your fully insured premium, or looking at an ASO administration fee if you're doing contributions to the state. You can look at all of those different angles, as well as benefit payments, if you've got internal resources that are supporting these programs, as well as if you need a surety bond for those ASO programs. These are a few of the items, as well as making sure that the financially looking at those fully insured premiums or the ASO admins, plus the benefit payment, plus the internal resources. If that's less than the cost of the contribution to the state, then you may want to be looking at that private plan. Looking into control, this is where you want to be considering where you want to be able to have ownership of the process. So many programs do have a top up, and then having that calculation can make things slightly more complicated. So you want to be looking at where your organization needs to maintain control of the process. If you need to have access to that overall claim experience, a state plan may be something that will work for you. If it is something that you don't necessarily need, you may want to consider moving into a potential private plan. Again, allowing the top-up benefits with other paid leave is another consideration when you're looking at that overall control. And then within the compliance bucket, you want to make sure that you are supplied from an employer perspective with the appropriate compliance support. Every organization has a different level of compliance expertise, and so making sure that you have access to the right resources is important. If you do not have a lot of a lot of access to those compliance resources, a state plan will probably continue to be beneficial to you. However, if you have more of a base for legal resources or compliance resources, you might want to be able to consider moving to that private plan. So if we look into the next slide, we've got a few case studies of projects that we've worked on that Grace is going to walk you through.
Thanks, Whitney. Yeah, so this first one, really it started with what we call our diagnostic. So it's a mid-sized healthcare company. They kicked this off because paid family and medical leave was implemented in the state where they have employees working. So they had already had a short-term disability, FMLA, and parental leave policy in place. All were being managed by multiple vendors and internal resources. So STD was with a carrier, FMLA with a TPA, and parental leave handled internally. When PFML came on board, they really wanted to look for ways to streamline this process and optimize their approach. So what we did is we looked at all of their plans, policies, agreements, a census file, everything we could get our hands on. Worked with the group to provide some education on the PFML program, what the options were for them to handle it, and really decided that a private plan could probably be the best option for them based on their goals, their demographics, and their, comfortness with the things that Whitney had just gone over. So the results really were, we went through some modeling for the disability benefits. We looked at their average duration, the elimination period, their other plan design features, and looked at some changes there, including some cost impacts. We relied on our actuarial team for some help there. And then we looked at the staffing model, which we'll talk about in a little bit as well, and adjusted that based on the expected workloads. We look at the incidence and duration to determine what the key number of staff would be on the internal leave team. And then we also conducted an RFP to find one vendor that could manage all of these leaves together. So we looked for SG, FMLA, and PFML, all to be handled with one carrier. And then we also supported further integration by including the COVID leaves, if you can figure out what time this is, and incorporating that fully insured LTD into their benefits. So the results here really were some pretty significant savings in the first year of implementation. If we go on to the next one. This was also a regional hospital and educational system down south. And they were really looking for some funding efficiencies here. They had already had some systems and processes in place internally that we really tried to, tie on to with the absence program. So STD and LTD were fully insured through a carrier. Workers' comp was self-insured and handled internally. And then they also had a captive insurance vehicle in place. So we really focused on leveraging those existing structures and trying to reduce some of the duplication and some of the systems that were being, handled through different vendors there to try to capture some financial value. So we also conducted an RFP for this group, and we sent those to both the internal resources, so that captive team, and then the potential external partners. It did end up making the most sense to shift to the STD program from fully insured to a captive solution. And then we work to also insource the STD administration. So the insurance mechanism was handled in the captive. The administration was also handled by the internal leave team, and it was integrated further with the workers' comp administration. And then we leveraged those existing processes from the workers' comp team to establish best practices and, try to do those in a coordinated way. And then we built upon that internal business case to make a to gain approval for that expansion into STD and LTD as well. So there were some pretty significant savings here as well in year one. And then when LTD is implemented later on, we do expect additional savings. And then digging into the staffing, really what we're looking at here, like I had said earlier, when we look at the model, is we try to identify what the key roles are that the people at the company are actually doing internally. Oftentimes when we're outsourcing, there's this feeling that, okay, the employer can kind of wipe their hands of this, but there is so much responsibility that is still on the employer. It can never really be a fully outsourced solution. So looking at the chart on the right, these are really the responsibilities the internal staff will have, regardless of how a program is managed. So it's usually returning people to work, communicating with employees, managers, different parties, working through that accommodation process as part of the ADA, helping with eligibility determination or answering questions from the carrier, and on here. So on the left, we do have a little bit of a case study, but as the employer size increases, often so does the need for the number of staff needed internally to manage those leaves. So when we're talking about insourcers, those are people who are handling leaves internally. 64% of them have a distinct department to manage leave for their company. And then outsourcers, also 66% of them have internal staff members involved in supporting that leave. And they're all managing these things on the right. So then when we're actually working through the staffing model ourselves, we'll look at your actual leave, incidence rates, duration, and the activities that they're managing and try to get to that number. So for this case study, we saw that there was about 4 to 5 employees needed, full time. This is their full job to help manage these leaves, and that is in an outsourced model. So it is still a significant amount of work.
Laura, what can you tell us about your staffing experience?
Yeah, absolutely. So, we, beginning of 2020, as PFML was launching in 2021, we made the specific decision to outsource our family leave to the state and insource our PML, the medical leave, because we wanted to dovetail the PML with the same documentation as our STD claims and roll into the LTD claims. So, I would recommend for this group that, certainly your mass PFML options to insource or outsource certainly will dovetail, as you know, with your FMLA obligations that are still there, disability, but also your workers' comp vendor. So, or if you administer in-house. So the more administrative vendors you have, there's an increased need for staffing to manage and coordinate between the vendors, because the vendors do not always talk to each other. As you know, the state doesn't talk to outsourced vendors or workers' comp carriers. So if the FMLA, the PFML, the disability, perhaps even the workers' comp is with one vendor, it requires less staff, less coordination for that internal team. And so something to consider if you do outsource any aspect of it, whatever you outsource, whether it's disability, FMLA, workers' comp, PFML, you want to make sure you're asking, do you have the right vendor for this complex landscape? So some of the things that we consider is, does the vendor have the right technology to increase efficiencies on our staff and our internal teams? Do they offer direct custom communications to managers using your specific company-specific language? Is there interplay and integration between the workers' comp system? Very often you have an employee who is out, has a workers' comp knee injury, but having a private plan, we can go peek to see, oh, they just had a knee replacement under the PML plan with our private plan, and we have access to that medical, and that kind of leverages the outcome of that workers' comp claim. And another thing to ask any of your outsourced TPAs that you have is, What integrations does that vendor have to talk to your timekeeping system or your HR system? For example, if an employee reports their intermittent leave to the vendor, will that cascade to your timekeeping system or vice versa? If your vendor approves FMLA disability, does that vendor then talk to your HR system to put the employee on a formal leave and then return them? So ultimately, I would recommend that you'll have to identify what is your North Star when assessing your program. Is that employee and manager experience, one phone call, one claim? Is it your clinical staff? Is it your providers that work at your hospitals, that work in your outpatient practices? Do they have to fill out multiple forms for state versus disability vendor? Is staffing resources on your internal team a priority? And certainly, is your financial spend needing to drive your decisions? These are not easy questions to answer. And I think every few years, our North Star might shift, left to right. Thank you.
Yeah, I think that's a great point, Laura. It's always important to review this with a fresh outlook on a regular basis. Oftentimes, when we're talking with employers for the first time or, after a few years of working together, we find that some of these leave team members are performing duplicative actions that the carrier is handling or that others are able to do. So I think it's always a great reminder to just refresh that outlook and see if there's any, improvements or opportunities to make some adjustments.
Thanks, Grace. So on the next slide, we are going to be providing a few things to the audience, key items to consider when you are looking at your paid family and medical leave programs. It's going to have several questions as well as considerations as you look at those programs. And on the following slide, as mentioned in the chat, we will be distributing this deck. We do have a brand new leave report from Alera Group, and this is going to provide you access to all of that information. We greatly appreciate all of your time today. Thank you.
Yes, thank you so much for sharing your time with us today and going over all this important information. And I know there's a lot of takeaways that folks have from all of this and learnings. And I saw some questions you answered throughout the presentation, and I'm sure our members will be reaching out. So again, thank you all, and for those who are joining us live today and watching this after, for sharing your time and learning about this. And we also have some additional upcoming MHA events as well. And we look forward to seeing you at future events. Thank you so much.